Hello friends, welcome to Sato Career 2.0 online nursing channel. This is November mock test series. We are guiding the nursing aspirants for writing the RRB and AIIMS NORCET exam. So we are conducting mock test series for all the aspirants at free of cost. Every week, Sunday, this mock test will be conducted. The link will be shared in the WhatsApp. Those who are interested can approach me and they can take the test. Marks will be released, and those who get 80 percentage above will get the e-certificate. So please subscribe to Cytocare 2.0 online nursing channel before seeing all the questions in this video. In this video, there will be 50 questions. I hope these questions you will enjoy. Let's go to the first question of the day. Which one of the following is called the endometrium of the pregnant uterus? Option A, chorion, B, amnion, C, morula, D, decidua. The endometrium of the pregnant uterus is known as option D, decidua. Question number 2. Birth weight of the newborn more than 4,000 gram is called A. Microcephaly, B. Macrocephaly, C. Macrosomia, D. Microsomia. Newborn which having 4,000 gram and above weight is called as option C. Macrosomia. Question number 3. The umbilical cord dries and separates by aseptic necrosis in option A 3 to 5 days, B 5 to 8 days, C 9 to 12 days, and D more than 12 days. So how many days it need for the umbilical cord to get dry and get separated? The right answer is option B 5 to 8 days. Question number 4. An example of positive feedback mechanism in our body is option A oxytocin in childbirth, B regulation of thyroid hormone, C temperature regulation, D baroreceptor mechanism. The right example for positive feedback mechanism is option A oxytocin in childbirth is the right answer. Question number 5. Insulin is not administered through oral route because A. It causes GI bleeding. B. It causes nausea and vomiting. C. It destroyed by GI tract. D. None of this. Why insulin is not administered through oral route? The right answer. It is destroyed by the GI tract. Hence, it is not administered through oral route. Question number 6. Which of the below is not a function of the fibrous skeleton of the heart? Option A. Act as a point for insertion for cardiac muscles. B. Form structural foundation for heart valve. C. Conduct impulses from atria to ventricles. D. Prevents overstretching of the valve. Which of the following is not a function of the fibrous skeleton of the heart? The right answer. It does not conduct impulses from atria to the ventricles. Question number 7. All are components of KMC, kangaroo mother care, except A. Skin to skin contact, B. Weight gain, C. Exclusive breastfeeding, D. Early discharge. Except early discharge, all other three things are the components of kangaroo mother care. So answer D is right. Question number 8. First form of milk secreted by breast during the first 3 days following delivery is called A. Transitional milk, B. Colostrum, C. Core milk, D. Hind milk. So which is the right answer? The right answer is option B. Colostrum. Option B. Colostrum is the milk secreted by breast during the first 3 days following the delivery. Question number 9. In India, universal immunization program was launched in the year option A 1978, B 1985, C 1992, D 1997. The universal immunization program was launched in India in the year option B 1985. Option B 1985 is the correct answer. Question number 10. Vaccine Vial Monitor (VVM) is used for monitoring option A. Temperature effect of the vaccine, B. Efficacy of the vaccine, C. Immunogenicity of the vaccine, D. Impurity in the vaccine vial. So why we are using VVM, vaccine vial monitoring? The right answer, it is used to detect any effect of vaccine on the temperature, by the temperature. A is the right answer. Question number 11. What instruction should the client be given before undergoing a paracentesis? Option A, NPO 12 hours before procedure. B, empty the bladder before procedure. C, strict bed rest following the procedure. D, empty bowel before procedure. So what instruction is appropriate that is given to the client before undergoing paracentesis? The right answer is empty the bladder before procedure. That is the exact answer. Empty the bladder before procedure. Question number 12. Valsalva maneuver can result in bradycardia. Which of the following activities will not stimulate Valsalva's maneuver? Option A. Use of stool softeners. B. Enema administration. C. Gaggling while toothbrushing. Option D. Lifting heavy object. The following thing which will not stimulate Valsalva maneuver. The right answer is use of stool softener will not stimulate Valsalva maneuver. Question number 13. A construction worker, 56-year-old, is brought to the hospital after falling from building. The nurse should be most concerned if the assessment revealed option A, a depressed fontanelle, option B, bleeding from ears, option C, an elevated temperature, option D, reactive pupil. The correct answer. The more concern in the assessment when a 56-year-old is falling down from the building should be on bleeding from the ear. That has to be checked. Question number 14. The difference between oral and rectal temperature is A 1 degree Fahrenheit, B 2 degree Fahrenheit, C 3 degree Fahrenheit, D 4 degree Fahrenheit. The difference between oral and rectal temperature. The right answer is option A 1 degree Fahrenheit. Question number 15. The respiration is controlled by the respiratory center in the brain is called option A hypothalamus, B midbrain, C. Medulla oblongata. D. Cerebellum. The right answer is option C. Medulla oblongata, which controls the respiration in human being. Question number 16. The wandering phagocytes found in the alveoli are called A. Alveolar macrophages. B. Goblet cells. C. Pulmonary cells. D. Charles cells. So the wandering phagocyte in the alveoli are known by its name only. Alveolar macrophages is the right answer. Move on to question number 17. Which substance does not normally pass through the glomerular capsule? Option A albumin, B glucose, C sodium ion, and D urea. The substance which does not pass through the Bowman's capsule or glomerular capsule is proteins like albumin. Albumin is the correct answer. Question number 18. Which white blood cell form antibodies? A. Neutrophil, B. Basophils, C. Lymphocytes, D. Monocytes. The substance in the blood which is responsible for the formation of antibody is B. Lymphocytes. B. Lymphocyte. B cells. Question number 19. A cold chain should be maintained to preserve A. Costly injections, B. Vaccines, C. Ampules, D. Blood products. So why we are using the cold chain? The cold chains are used to preserve the vaccines. Question number 19, answer B is the right answer. Question number 20. most heat resistant and heat sensitive vaccine? Option A, TT and DPT. Option B, OPV and TT. Option C, DPT and measles. Option D, DT and OPV. The the most heat resistant vaccine, the heat sensitive vaccine. In the same order, you will tell. The answer is the heat resistant is OPV and the heat sensitive vaccine is TT vaccine. Option B is right. Question number 21. Which disease is called father of public health? A. Malaria. B. Cholera. C. Leprosy. D. Influenza. The father of public health. The right answer is option B. Cholera is the father of public health. Question number 22. What is a Basil calmette curing BCG? A. It is a live attenuated vaccine. B. It is a killed vaccine. C. Immunoglobulin. D. Toxoid. What is BCG? Bacillus calmette guerin. The right answer. It is a live attenuated vaccine. Question number 23. Which of the following syringes used for BCG vaccine? Option A, 2 cc syringe. B, 5 cc syringe. C, tuberculin syringe. D, 10 cc syringe. The syringe which is used for administering BCG vaccine, either 1 cc or 2 cc syringe is used. Option A is the correct answer. Question number 24. How many daughter cells are produced in meiosis cell division? Option A 8, B 6, C 4 and D 2. The number of daughter cells produced in the meiosis cell division is option C 4 number of daughter cells are produced. Question number 25. Which cell produces intrinsic factors within the stomach? Option A chief cells, B enteroendocrine cells, C mucus cells, D parietal cells. The cells which produce intrinsic factor in the stomach is option D parietal cells. Question number 26. Substances used to counteract the effect of poison are A antidote, B androgen, C antibiotic, D antacid. The substance which is used to counteract the effect of poison or antidote. Question number 27. The nurse needs to carefully assess the complaints of the pain of the elderly because the old people, option A, have decreased pain threshold, B, have altered mental function, C, are expected to experience chronic pain, option D, experience the reduced sensory perception. The right answer. The old people has to be assessed carefully for the complaint of pain since they have reduced sensory perceptions. That is the reason why we need to assess carefully for the pain symptoms of a older people. Question number 28. A client who is having pheochromocytoma complains of sweating, palpitation, and headache. Which assessment is essential for the nurse to make first? Option A, pupil reaction. B, hand grips. C, blood glucose. D, blood pressure. So a client with pheochromocytoma is complaining of sweating and palpitation and headache. The initial assessment the nurse should do is to check the blood pressure, vital signs. Option D is right. Question number 29. What is the best reason for the nurse in instructing the client to rotate injection site for insulin? Option A, lipodystrophy can result on extremely painful. Option B, poor rotation technique can cause superficial hemorrhaging. Option C, lipodystrophy areas can result in causing an erratic insulin absorption rate from this. Option D, injection sites can never be reused. The correct answer why we are rotating the injection site while giving insulin, the right answer is option C because the lipodystrophy areas can result in causing the erratic insulin absorption. That is the reason. Question number 30. The client has severe rectal bleeding. with 16 diarrheal stool a day, severe abdominal pain, dehydration, tenesmus. Due to these symptoms, the nurse should be alert for other problems associated with what disease? Option A, diverticulitis; B, Crohn's disease; C, ulcerative colitis; D, peritonitis. So, severe rectal bleeding with more than 15 frequency of diarrhea episode, abdominal pain, severe dehydration, and tenesmus is also present. So, here the condition may be associated with option C, ulcerative colitis. Question number 31. Breast milk can be stored at the room temperature for option A 4 hours, B 2 hours, C 1 hour, D 30 minutes. Breast milk can be stored at the room temperature for how many hours? Option A 4 hours is the correct answer. Question number 32. A client has a plaster cast applied to the left leg. Which comment by the client following the procedure should the nurse address first? Option A, my toes are stiff. Option B, my toes are pain. Option C, my cast is still wet. Option D, my pain is a 3 in a rating scale. So the thing need to be taken as a priority for a nursing care should be option A, my toes are stiff. Question number 33. Which value of HbA1c in a diabetic patient is an indication of good control of your blood sugar level? Option A 5.7 to 6.4 percentage, B more than 6.5 percentage, C 6.5 to 7 percentage, D all of the above. A good indicator for controlling the blood sugar level when assessing the HbA1c report in a diabetic patient will be 6.5 to 7 percentage. Option C is right. Question number 34. What is the normal color of colostomy stoma? What is the normal color of colostomy stoma? A bluish, B dark red, C pale, D pale pink. The normal color of colostomy stoma. Option D pale pink is right answer. Let's move on to question number 35. In general anesthesia, which sensation disappear at last? Option A, sensation of pain. B, vision. C, hearing. D, taste. The sensation which disappear at last during general anesthesia is option C, hearing sensation decrease at last. Sensation of pain, sensation of touch decreases first. Question number 36. Infected dressing should be discarded in a bag of color. A yellow, B red, C green, D black. So infected dressings are discarded in yellow color bag. Question number 37. Pain in the right lower quadrant beyond appendicitis could mean A gallstones, B kidney stones, C irritable bowel syndrome, D diverticulitis. So pain in the right lower quadrant beyond appendicitis that could be due to option C irritable syndrome, bowel syndrome, IBS. Question number 38. To convert pressure reading from centimeter of water to millimeter of mercury, the reading has to be multiplied with which factor? A 1.36, B 1.26, C 2.36, and D 2.26. The factor to be multiplied should be option A 1.36. Question number 19. Sorry, question number 39. The cause of ascites can be A hyperalbuminemia, B hypoalbuminemia, C hyperlipidemia, D hyperglycemia. The cause of ascites could be option B hypoalbuminemia. Question number 40. What type of substance is a human chorionic gonadotrophin? A. Tubular substance, B. Hormone, C. Viral substance, and D. Bacterial substance. HCG is a hormone is right answer. Question number 41. Who were the early pioneers of immunization? A. Chinese, B. Egyptians, C. Mesopotamians, D. Greeks. The early pioneers of immunizations are option A. Chinese. Question number 42. According to the School Health Committee of India, the minimum land area for elementary school education is A 5 acre, B 10 acre, C 15 acre, D 25 acre. So to start a elementary school, you need to have minimum how many acres of land? The right answer is 10 acres of land minimum is needed, which is suggested by the School Health Committee of India. Question number 43. What is the symbol of the element bromine? Option A B, option B Be, option C Br, option D Bi. The element bromine is represented by the symbol Br, bromine. Question number 44. Applying an unfair amount of pressure to the subjects to complete the responses quickly is called A. Measurement bias, B. Inclusive bias, C. Procedural bias, D. Selection bias. So while applying pressure, excessive amount to the subjects to complete the response quickly is known as procedural bias. Option C, procedural bias is right answer. The next question is 45. So here you need to find the next number in the series. We have 3, 7, 16, 35 and 74. So option A 187, B 143, C 147, D 153. So you have to find what number comes next to 74. So we have 3 and we have the second number as 7. How that 7 comes? 3 plus 3, 6 plus 1, 7. So next to 7 we have 16. So how that 16 comes? 7 plus 7, 14. So plus 2, that becomes 16. So followed by 16, the number is 35. So we got 16 plus 16, 32 plus 3. So we are adding one number like first 3 plus 3, 1, 7 plus 7 plus 2, 16 plus 16 plus 3. And similarly 35 plus 35, 70 plus 4, 74. And you need to add 5, 74 plus 74 plus 5. So that is we get 153. Answer is option D 153. Question number 46. World Heritage Site Fatehpur Sikri is situated in which of the following state? Fatehpur Sikri is situated in which of the following state? Option A Rajasthan, B Uttar Pradesh, C Bihar, D Telangana. Fatehpur Sikri is situated in Uttar Pradesh, Agra. Question number 47. An investment made by MNC is called option A direct investment, B corporate investment, C foreign investment, and D mutual investment. The MNC multinational committee or multinational MNC. The investment is known as foreign investment. The investment is known as foreign investment. Question number 48. MS Swaminathan is an option A agricultural scientist, B ISRO scientist, C nuclear scientist, D radiologist. Who is MS Swaminathan? MS Swaminathan is the Batma Bharat Ratna award winner in 2024, and he is a agricultural scientist. He is from Tamil Nadu. He did revolution in the field of agriculture. Question number 49. What is the legal age to perform marriage for girls in India? A 21 years, B 18 years, C 16 years, D 23 years. The legal age to perform marriage for girl in India is 18 years, but for boys it is 21 years. And move on to the last question in this mock test series video. Question number 50. The number of oscillations of a particle in unit time is called of the wave. Option A frequency, B. amplitude, C. wavelength, D. time period. So number of oscillations of a particle in a unit time is called as, the right answer is option A, frequency. So here we come to the end of this video. So November first week mock test series we have completed the 50 questions. I hope you enjoyed and thanks for watching this video. Thanks for all who participated in the mock test series. Satu Career 2.0 online nursing channel will organize every Sunday one mock test series. Initially, we are starting with 50 questions. Later, we may move up to 100 questions per mock test series. So, please comment about this video questions in the description box below. I hope you all enjoyed this video. Please like this video, comment about this video, and share this video to all the nursing aspirants groups and to all your friends. And don't forget to subscribe my channel. Meet you again with another important questions for the nursing aspirants. Take care. Bye bye.